welcome into To Your Health, and boy do we mean to your health. And it's the time to start getting healthy, start living again, start taking care of yourself and taking responsibility for staying healthy. And we're so excited. We've got Susan Reed. I've known her a long time, and she is with the Cancer Center here in Montgomery on Carmichael Road. And you do amazing things. But even all those amazing things weren't enough. So now, Baptist, the Cancer Center, has come up with something wonderful. Susan, what is it?
Well, Miss Virginia, we're very excited to be a part of something great for our community. You know, at Montgomery Cancer Center, the staff and the physicians are very focused on making sure that we're providing the best care we can for our patients. But we really started to see a need in our community for education and outreach and just access to screening. And so before COVID, we started talking to each other about what could we do to make a difference in our community. We serve about a 12-county region at the Montgomery Cancer Center, both in Montgomery and Prattville. And we said to each other, we need to start sooner. We need to start earlier. We need to be in our community, sharing information and screening people in the community to make sure they understand the importance of taking care of those screenings. And so we looked around the country and said, what are other people doing, right? And so we identified this bus program, and it's called Driving Hope. It's actually a medical clinic that can come to your community and provide cancer screenings and education and prevention awareness in your community.
This comes to you. How did this bus come to be? This is not an inexpensive venture.
It's not. It's a 37-foot custom RV, just like you'd see tailgating at a football game.
Okay.
Except when you go inside, it's a medical clinic. It has laboratory services, it has an onboard restroom, it has an exam room with an exam table, so you'll feel like you're in a physician's clinic. It's just, it can ride around town and go to different communities.
And staff, what kind of staff?
Sure, we're going to staff it with a team from the Montgomery Cancer Center.
Okay.
What better a group of people who know
They know their business.
They know their business and are exceptional. So we are going to build a program around the bus, which is actually the cornerstone of the program. But what's unique about the program is we'll be out in the community about 10 days a month, and then the rest of the time we'll be working with those people that we met on the bus to get them navigated into a healthcare service that's appropriate for them in their community. Based on our connections with primary care doctors, our connections with specialists,
right,
we're able to reach out to say, we met this person on our bus, we really think they would benefit from services from you in Troy or in Selma. We can get them connected and get them navigated into healthcare services that take care of them for the long run.
Oh, what a godsend, because that's half the battle right there. It really is.
Mm-hmm.
So let's say I'm in an outlying area. Mm-hmm. How do I get Hope to drive to me?
Well, our bus is in production right now. They're
Okay.
actually made in North Carolina, so it takes several months to have the bus made. So we expect it to roll into town in the fall, early winter, and then we'll be working with the program manager to make reservations throughout the community. And our hope would be is that we use programs like yours to announce different events or have an event calendar that we can be in different locations. We're going to be working with different organizations such as churches and civic organizations to have very dedicated dates. So maybe the first Monday of the month we're in Troy, or the second Tuesday of the month we're in Billingsley, or different areas that kind of make sense to be have some routine so that we can be familiar in the community.
Well, who actually funded this? You know, there's always something good behind everything good.
We are just tickled that we have been able to reach out to corporate sponsors in our community to help us offset the cost of the bus. The bus is about $370,000 to actually purchase it, and we've been partnering with local organizations, Alpha Foundation, Alabama Power, Hyundai, and different organizations that have been able to help us offset some of those costs. But we are just so thrilled that Joy to Life, foundation that you're very familiar with, we share a common mission.
Right.
And so when we approached Joy to Life, they could not have been more excited to help us and are going to be a partner with us because of their program that offers mammograms to women who may find themselves underinsured or not insured in Alabama. And so just a great partnership with Joy to Life for bringing driving hope to the community.
Oh, I just think this is so terribly needed. And we were talking earlier, you know, if you 6 weeks, a couple of months, Susan, it can make all the difference in the world.
You can.
And in discovering something, folks, don't let it slide. And this is hope coming to you. Oh, thank you so very much. We appreciate it. And listen, next week I'm excited because next week we're going to tell you exactly what this is going to do for you. So listen up because it's something that we all need. And thank you so much for being with us, and we'll be right back.